My name is Alicia Walker, and I am going to read the questions for the OCD assignment and answer them to the best of my ability. The first question is: did this personal account confirm or dispel any of your knowledge of OCD? I would say that the video and the textbook dispelled the knowledge that I thought I knew about OCD, because I had always thought that OCD was where you're overly organized and you just had to have things orderly. However, after reading the textbook and watching the video, I learned that OCD is where individuals feel kind of compelled and compulsive. They have an urge to have things aligned and have everything even and symmetrical. For example, someone with OCD, they may touch a door one time, but they have to go back and touch the door twice. It has to be even. So in pairs, as far as 2, 4, 6, 8, everything has to feel balanced and symmetrical. And when things aren't balanced and they're not symmetrical, that's when they get kind of obsessed with finding ways to make things feel balanced. And it kind of, you know, plays with their mind to where someone with OCD kind of feels that, you know, if things aren't even or symmetrical, something bad's gonna happen. They kind of feel like their world comes crashing down if things aren't done perfectly. You know, they're perfectionists, and it starts to become an obsession with things being perfect, things being aligned correctly, even simple things as far as on the ground, with lines, being organized, having things neat, orderly. Things can't be wrinkled. Things have to be symmetrical and even. And when they're not, it causes them to, you know, have anxiety. They may have sweat. They may sweat. It's just a very difficult time for someone who has OCD to function when things aren't going exactly as they planned and it's not even and balanced. That is what I learned about OCD after watching the video and reading the textbook. The last question is: what are some of your biological, psychological, and social variables that I need to pay attention to if I encounter a client with OCD? Well, first of all, after reading the textbook, I learned that biologically, some people have stated that um, it can be inherited, the trait of OCD. Like if there's someone in the family that may have OCD, a parent is more likely for someone to inherit that same OCD trait. And just understanding that, you know, this is not something that they can control when working with a client who has OCD, who may have inherited the trait or just may be having psychologically not be on the same page as they want to be. I feel like that plays with them in their mind, and it's difficult to cope with that, and having to feel like, you know, this is something that I can't control. You know, their impulses are not balanced and they're off. I think that as social workers, we need to understand that there's things that are going on with someone who has OCD in their brain that they cannot control, and we need to be understanding and patient of that in all aspects. As far as biologically, that's something that they may have inherited. As far as psychologically, is something that is beyond their control, that is, you know, really causing them disarray in their brain. And then socially, kind of just understand that, you know, a lot of times people who have OCD, they may feel as if people can't relate. They may have less friends. They may not be as social because, you know, most people, they may judge and think that, you know, them and their repetition of ways and things of wanting to for things to be balanced is different. And a lot of times when people do have a diagnosis and they're different and it's not what people consider to be normal, it is difficult for them to find acceptance. And as social workers, I think that it would be best for us to, when we do encounter a client with OCD, to just be understanding and patient and just try to communicate in the best way that we can, be more of a listener opposed to someone who speaks, because someone with OCD, they may feel as if their voice aren't heard, they may feel isolated. So it'd be good to, when speaking with a client socially, to interact with them in a way where they feel as if their needs are being met, as if they feel like they're being heard, and just being understanding that it is a disorder, it's something that is beyond their control, something that they can't necessarily control, and just be mindful of that and be understanding when working with a client who has OCD. Thank you.